Ah, hello. You're a little bit early. Let me just. You're about 45 minutes early. Alright, something really must be troubling you. I see. And, have you slept since you fell at all? Alright. We'll make sure that you don't actually have a concussion. 1 second here. Have a seat. Have you had any dizzy spells? Okay. What about stars? Have we been seeing stars or anything of that nature? Okay. Right. Okay. And how often do you say that you participate in that particular activity? Well, aren't you a lucky one? Most are lucky if they get to do that in a week under certain circumstances. Alright, so do you mind if I just take a quick look? Okay. Can you blink for me really quickly a couple times? Good. How about look up for me? Okay. And look down. Okay. And to your right. Okay. And how about to your left? Just okay. Well, your pupils don't appear to be dilating. I'm going to do a soft light here. Because if you do have a concussion, I don't want to shock the system. So I'm not going to directly put the light in your face. As of now, just relax. You don't have to do anything. Just sit perfectly still and regulate your breathing. Okay. Look at this little purple toy glove, if you would. Just follow it. Okay. With your head, with your eyes, please. Thank you. Good. Good. Alright. And then, if you could just focus on this ball right here, this red squishy ball. Just follow it as I move it around. Okay, good. Just sit still, please don't talk. Okay, and then let me pull up your file here. I am making some notes, but you have a history of bumping your head. So, I'm not judging, but yeah. No, I just want to be perfectly clear. Alright, I'm actually going to put on some gloves because I need to do a little bit more of a close-up inspection. And I don't want to touch you that much without gloves, so just continue to sit still. Again, don't say anything, I'm just checking pressure points here. Alright, can you swallow for me? Just a quick. Good. And swallow. Good. Alright, close your eyes for me. And with your eyes closed, look to your right, please. Thank you. Okay. And look to your left, please. Thank you. Alright. Now I'm going to hold your head by your chin. And my thumbs are going to be right here at the base of your chin. Right where your chin and your throat meet, okay? Now if you could swallow for me. Good. And try to lift your head up. Okay. And press down on my thumbs. And head down. Okay. Now try to turn your head to the right. And the left. Good. Can you look at my finger here? Just follow my finger really quickly. Good. Just follow my finger wherever it goes. Don't move your head. Do not move your head. Good. Okay. And switch and follow this finger. And just follow it wherever it goes. Don't pay attention to anything else. Still following this finger? Good. All right. Okay. If you could just sit still and blink for me once. Good. Blink for me twice. Good. Blink for me once. Good. Blink for me twice. Good. Alright. Pardon me. Alright. Can you focus on this little black L for me, please? Just relax. Alright. Based on what I'm seeing, I don't believe you have a concussion, which is good news. But I do want to just do a couple of other cognitive tests that would normally be associated with your optic nerve. It's an eye exam, but not really. More of a half of a cranial nerve exam. Is that okay? Good, I'm glad you have some time. Just to be on the safe side. Alright, so if you could just look directly at the bridge of my nose, and I'm going to just peek in with this light, check your pupil dilation. Now that I know that direct light isn't going to give you that big of a shock. Good. Just if you wouldn't mind not talking. I know you're very excited, and this can be possibly an effect of hitting your head. The reason I say that is your nerve endings. So your brain typically responds to beta waves, sound frequencies, and your brain will match the sound that you hear. And when you have a hard fall, sometimes you can be disorientated even without a concussion. And so your brain activity can either be very slow or on overdrive as it's trying to recalibrate itself, and you're trying to familiarize yourself with basic functions. It's a conscious thing, and it's not very common. It is extremely rare, but I just want to be on the safe side for you. Good. Perfect. Good. Relax. Good, 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 good. All right. Now, if you could close your eyes, I just want to see how receptive you are to objects in front of your face without actually looking. And we're just checking your sensory observation. Okay? So if you could just... Do you know what eye I'm covering up at the moment with an object? It's not touching, but it is very close to your face. Okay. Alright, we'll try again. And what eye was I covering that time? Okay. Alright, just relax. What eye was I in front of? Try not to think of if you felt any wind displacement, just based on your cognitive senses with your eyes closed. But don't do it based on feel. I want you to listen and focus. Okay. What eye was that in front of? What eye? Okay. Alright, and again. And again. Okay. You can open your eyes if you want, or keep them closed. It does not matter for the purposes of the exam. Okay. Well, open your eyes. Are you asleep? Because you're not adhering to my instructions. Usually, when I tell you to close your eyes and keep them closed, you have some sort of a response, or you do the exact opposite of what I tell you to do, because I've been your doctor for a long time, you've been my patient, and I know you're a little bit of a prankster, and you don't like to follow instructions. Oh, well, by all means, it does seem that you are actually asleep. So, let me just make a note of this for later, because this almost never happens until we are completely done. Okay, just checking for rapid eye movement since you are actually asleep. The good thing is, even though I know that you can't hear me, you don't have a concussion, And there's nothing adversely off to your cognitive skills. Note, I'm not speaking of your personality, only any medical capacity. I suppose I should let you sleep, since you did actually show up early, and I don't have another appointment for an hour and a half. I guess I'll let you get a little bit of sleep in privacy in my private office, because what's a good friendly neighborhood doctor for if not to let you utilize his means of making a living as your personal bedroom? So just continue to sleep, and I don't know, go do something else.